The country's health needs are accelerating and increasingly complex. We're up against staff shortages, service gaps and unrelenting pressure on the health dollar.
It's about, do we have enough services? And if we're all honest with ourselves in health, no, we don't.
We need to find new and smarter ways to make the best of our future workforce. This is one of them.
You okay? Apparently I'm really good.
I'll tell you after.
The nurse practitioner, the best of nursing combined with some of the best of medicine. One safe and cost-effective solution to building a more flexible future workforce.
You know, it's imperative to make sure that we make the best use of the healthcare workforce we've got to address that wide range of challenges. And I would suggest that nurse practitioners are an excellent solution in doing that.
Nurse practitioners are vital in the future health service. The way in which we're structured at the moment, based around doctors and other health practitioners, means that we're just not going to have enough people on the ground unless we actually think about different ways of doing it.
That's how Northland District Health Board sees it too. The far north has high needs in hard-to-reach places and not enough doctors to go round. Māori health providers needed a new and holistic way to keep people well and out of hospital. Adrian Murray's practice includes running a mobile clinic for Northland's Māori health providers. Her patients are country people who haven't seen regular primary health care like this in years.
You're not trying to get pregnant, Uncle.
Adrian Murray was one of the first nurse practitioners. She's qualified and trained to make diagnoses.
What is it like? What is the pain like?
Prescribe and manage medications.
I can't even walk properly.
And order and interpret laboratory tests and x-rays as an independent practitioner.
Let's get the x-ray done.
This is how these Northland pioneers created their nurse practitioner roles from scratch. Adrian was a primary healthcare nurse specialist with ambitions to be a nurse practitioner when she and Northland's general manager of funding, service development and Māori health, Kim Tito, put their heads together.
And part of that conversation also, which is really critical I think, is talking with the DHB partner to say, where are the service gaps, and ensuring that the scope of practice that I chose would be useful and beneficial to the DHB. So for example, I live in rural far north of New Zealand, so for me to go for a scope in facial plastics, for example, would be totally unhelpful to my DHB.
If you know your population health needs, your population demographics, your service gaps well enough that you can spot where a particular role that a nurse practitioner can provide can fit in as part of an overall delivery system, then think about how you can then develop that service. Because in our view here in Northland, nurse practitioners can actually span the service continuum.
While Adrian studied, she and Kim and their colleagues began to think laterally about new funding models, new employment models, and infrastructure to support Adrian and other nurse practitioner candidates when they came on stream.
I think it's really important for funders to understand that there is an infrastructure requirement.
Yeah.
As there is for any service delivery system, you can't just have a doctor and expect the doctor to manage by themselves. There's got to be technology enablement, there's got to be relationships well formed, there's got to be some form of authorisation logic that enables a nurse practitioner to function. That's vital, and that infrastructure is a really important operations issue that has to be in place.
It wasn't all plain sailing.
With any change, there's an adjusting of the seats, if you know what I mean. We all shuffle sideways up and down, and unfortunately, for other service providers, that's what they'll have to do. Because it's actually not about how we feel, about our personal attitudes. It's about providing a service to the people, and that's it.
Mid-Central District Health Board also established nurse practitioners to bridge their service gaps. Helen Snell specialises in diabetes.
That's what it normally is.
Yeah, so that recent change in dose was obviously quite effective for you. I know I make a difference. As a non-prescribing nurse in the past, I was able to make treatment recommendations but not able to actually provide a prescription. So in times that could delay treatment therapy being changed or altered by maybe a day or two or even longer.
So you speed things up, you save money?
Absolutely. I'm able to respond immediately to that person's health need. And I may need to consult, but that takes a short period of time, and I'm then able to give them, if it is a prescription, I can give that to them immediately. If it's ordering a diagnostic test, I can do that immediately.
We know that diagnoses are safe ones because nurse practitioners, firstly, have been educated to master's level. That education has been prefaced on 5 years of clinical practice in their area of choice. They are put through a rigorous assessment process by our regulatory body, the Nursing Council of New Zealand, and they are tested both academically and insofar as their clinical reasoning skills are concerned. So I'm confident that the nurse practitioner who has gone through that process is just as adept at making a rational, accurate diagnosis as a medical colleague in the same circumstances.
Previously, Helen Snell was the Diabetes Centre's nurse specialist. Now this nurse practitioner works in collaboration with her diabetes physician, Dr. Paul Dixon.
So I believe that these doses will be reasonable to start with, at least until we can get some idea.
Well, it sounds like you've got most things covered now.
We have a very strong partnership in terms of working together clinically and also leading the service. So he's the medical head for the service and I'm the nurse leader for the service.
She's able to do things a lot more independently. The additional training she's had, the fact that she can write prescriptions, and so it's much more of a practitioner-to-practitioner relationship.
A successful partnership. Helen's nursing and medical skills provide a one-stop shop for many of the centre's patients. She streamlines their journey, keeps them out of hospital, and frees up her medical specialist to deal with the more complex cases. Does it work well?
Well, I find it does, yes. I think we've got skills and abilities that complement each other.
We've seen evidence, clear evidence of where admission rates can be reduced, where you're utilising those sorts of services. We've also seen clear evidence where nurse practitioners are able to manage patients more efficiently and more effectively through the health service, and that obviously has benefits for the patients, but also has flow-on effects for that service provider and ultimately for secondary service providers as well. We're reducing the number of people coming through.
And they're also paying off. Sue Wood, Director of Nursing at Mid Central District Health Board.
A nurse practitioner attracts the same revenue as a SMO, so a specialist medical officer, and they are able to run clinics autonomously and so can do that in any setting remotely or locally, depending on what sorts of investigations they may need. They are very cost effective. You don't have to have the duplication and parallel types of clinics that you may have with a clinical nurse specialist or any, like a registrar or any other clinician.
Sue Wood has encouraged a number of her nurses to become nurse practitioners across primary and secondary care. And now Mid Central is growing more. Where do they fit in?
Anywhere. It's huge from that point of view. Wherever patients are who have health needs, there can be a nurse practitioner.
Northland's nurse practitioners are set to play a significant role in this region's future health delivery.
So we've got some way to go, but from what we've seen, it's very commensurate with the experience coming out of the US, where nurse practitioners, have been established now for some 20 or 25 years.
Yeah.
Our pathway is very similar to what they've gone through, but we've actually leapfrogged
We have.
some of that development pathway through the experience that they have gained and then been able to share with us.
That was so good, I feel 150% better.
Nurse practitioners are flexible. They can work across services for 2 or more employers, and they tap into a wide range of funding sources to make their jobs happen. Lead Chief Executive for Nursing, Jim Green, says his colleagues should just get on with it.
It really comes back to DHBs now, working with PHOs and other providers to actually be looking at where nurse practitioners can work and create the opportunities for them. And sometimes change needs some motivation, and chief executives are ideally placed to get that change, because chief executives, your whole job is around improving outcomes for people within the community, and nurse practitioners are fundamental to that.
Oh yes, you'll be yelling at me. Hurry up!
For resources, toolkits and further reading, go to District Health Boards New Zealand's website and follow the link to Nurse Practitioner. The Nurse Practitioner Facilitation Program is managed by District Health Boards New Zealand on behalf of the 21 District Health Boards and the Ministry of Health.